Good afternoon, everyone. Thank you for joining us for Maintaining Safety, Sanity, and Service as States Reopen During the COVID-19 Pandemic, presented by Cooperator Events and sponsored by Denali Property Management. Today, we're happy to welcome our expert panelists, Harold Burlow, Vincent Rapola, Fran McGovern, and Paul Bergman. Harold has been a senior property manager with Denali for 5 years and brings over 30 years of experience in managing all aspects of multifamily buildings in Hudson County. He has developed, built, and managed over $250 million worth of properties over the course of his career and has expertise in building systems, administration, financial reporting, budgeting, and contractor and vendor oversight. Vincent is Director of Field Operations for Denali and has been in the community association management industry for 15 years as a property administrator, property manager, and general manager. Fran has practiced in the community associations field for the past 24 years. He has served on CAI New Jersey's board of directors and on several of its committees. He's a founder of McGovern Legal Services, LLC, whose 11 attorneys specialize in community association law in communities throughout New Jersey. Paul is the president of Viking Pest Control and has been with the company since October of 2017. Established in 1980 and headquartered in Basking Ridge, New Jersey, Viking Pest and its 250 employees offer pest control, disinfectant, and sanitization services to communities and businesses in New Jersey, Delaware, the Eastern Shore of Maryland, and Eastern Pennsylvania. Our moderator is Alan Sidransky, a staff writer and reporter for The Cooperator, who is himself a co-op resident and brings many years of experience in residential real estate and finance to our conversation. Audience members, during our discussion today, please use the Q&A button at the bottom of your Zoom screen to submit questions for our panelists. While we may not be able to answer every submission, we will do our best to cover as many as possible in the time we have. You're welcome to include your name and location or to remain anonymous. Again, thank you all for joining us today. And without further ado, we turn the floor to our panelist and moderator.
Welcome to the audience and also to our panelists. First question today is for Fran McGovern. What are the best ways for communities to enforce social distancing and other protective measures in common areas as they reopen? What's legally within their power?
Hey, thanks, Alan. First of all, thanks so much to Denali Management for sponsoring today and for the Cooperator for putting this event on. And thank you for all the attendance today on this rainy Wednesday afternoon. So what are the best ways to enforce social distancing and other measures designed to protect against COVID-19? So there are lots of them. The one being discussed most right now is not opening the amenities, right? Not opening the amenities at all. And that's really a risk management decision for the association and the board. But the association is within its rights in terms of enforcement and risk management not to open the amenities. Some other ideas have been partial openings. So partial openings of facilities. So for example, if you have a gym, maybe certain people can only use the gym by appointment. You have an online appointment scheduling type of software, something like that. Other ways of enforcement are disabling fobs for those who refuse to comply. So if somebody has a fob to use a certain amenity, you have every right to disable that fob to access various rooms, meeting rooms, facilities, weight rooms, etc. If they refuse to comply. Hire monitors. The association is within its right to hire monitors to help with enforcement, to guide and instruct residents, visitors, and others who come to the association. So that's all within the rights of the association. Another way, it's not so much an enforcement issue, but I think the associations are within their rights these days that if certain facilities are going to be open, and the classic one is the gym, and they are going to involve significantly more expense just associated with that particular amenity, the associations may be able to charge a user fee to those people who sign up for the gym, who just want to use the gym. In that way, you can help defray the cost of things like enforcement, compliance, etc.
That's great. Along that line, we had a question from Kathleen in Linwood, New Jersey, and she describes many of the elements that you just spoke about. Specifically, though, I'd like to understand for her, if the association does not open, what legal liability do they hold relative to the residents who want it open? Can they be sued? And also, if they go against rules set out by, say, the state of New Jersey or the local government, can they? What would be their problem in terms of that? Would they be sued from the government? How would that work?
Sure. So they're great questions from down there in Linwood. Hi in Linwood. Hopefully the shore is doing well for you. And a great question. So the thing to keep in mind about governmental orders is they are a baseline. They're a floor. So just because the governor gets on TV tomorrow or on a webcast tomorrow and says, hey, associations, swim clubs, etc., you're all free to open. That does not mean associations are compelled to open. That means the associations can open if it's reasonable in their particular cases. So you have to be very careful of that. People think that when government says you can open your weight room, you can open your swimming pool, etc., that it means you must. So that is totally not the case. So depending on your particular circumstances, you are not compelled to open. So for example, if you have a facility that is so small and so tight that no matter what you do, you can't make the gym area safe, you can't open it. Okay, you can't open it. If you have a population that is at such high risk, so for example, I represent some clients where perhaps the average age of the community is 80 years old. You may not want to open the weight room at all, even though that's a great large weight room. So you have to judge by the facilities as well as your populations in particular. So it's very risky. Now, can the association be sued to compel them to open the facilities? Yes. Yes, it can. But the business judgment rule generally protects associations' decisions if it's based on good information. So as long as it's a reasonable decision based on the facts that the board has found, the board will not be liable. In addition, and I don't want to go on too long, I know you got to go, Alan, is that the carriers are more likely to defend a case under the policy for saying, hey, we find it reasonable to be closed, rather than the association improvidently opens the facility and then someone gets sick or injured or dies because of COVID-19, and then there's a claim at that. Because right now, not all, but most carriers are saying they're going to resist covering COVID-19 claims.
Great, thank you so much. So I'd like to move on to the next question, and this would be for Paul. Common areas, there are many different kind of common areas in a building. So there are unavoidable areas that we have to access, like elevators, lobbies, hallways. We're touching buttons, handrails, doorknobs. There are indoor spaces like playrooms, gyms, and lounges. And there are also outdoor spaces such as gardens and roof decks. How do cleaning and social distancing protocols differ in these different types of spaces? And what are the best methods to get residents on board with new rules? How do you get people to buy in, especially considering how political the issue has become?
Thank you, Alan, and good afternoon, everyone. Certainly the cleanliness and sanitization is a difficult topic because there's many different levels of sanitization and many different levels of cleaning. We see this, in our space. We have neighbors down the hall who have a janitorial service that's coming in, who are using no PPE, just come in, do some wipe downs. Our protocol is completely different. The problem is there's no standard of disinfecting or sanitization that's out there, so there's no governance or guidelines. People are getting quotes for someone to come in, so people come in and you don't know it's kind of like you're rolling the dice on what you might get. So in terms of the cleanliness part of it, property managers, folks who are making, the buyers who are making those decisions really need to understand what they're buying. You will see a wide variance. I mean, $1 per square foot or greater in what you're getting quotes out there. And unfortunately, this is going to be one of those things where you probably get what you pay for. The other piece of that is where do you want to make your investment? And I would tie this into, you're saying, hey, it might be a political thing, but I think the spin to your tenants, to your clients is we're making an investment in your safety. So this isn't political. This is about you and about keeping everyone in this facility safe. So really spin it to the investment side of this and what you're putting into it. Understand these are their dollars at work. I'm sure we all hear about, hey, you're spending our money, you're spending our money. Well, we are spending your money, but we're spending it to keep you safe. And this is where we've deemed it to be the most effective. So, common kitchen areas, food prep areas, gym areas are certainly going to be the where you would have a more stringent protocol from a cleaning standpoint. Somewhere that's, just some couches out in a common area or outdoor seating or, picnic tables. You're not really going to be able to do anything effectively out there that sunlight and nature and time probably aren't doing for you.
Okay, so I want to follow up with that, on that with a question we had from William in New York City. And this is kind of an interesting situation. He inquires about annual meetings. And he says that, which we all know are generally held this time of year. So he says that his building has pushed off the meeting, but they've done nothing about setting up a virtual meeting via Zoom. So his question has to do with if they had to weigh factors of whether to hold the meeting in person or to have a Zoom meeting, what should they consider about having it if they were going to have it in person? Or should they, I mean, is that just a no? And should they just not do that?
Personally, I'm going to go with that's a no right now. We still don't have, absolute clear governance on what the state of New Jersey is doing. You're putting yourself at risk. You're opening yourself up to potential claims. Why do it? Zoom's a fantastic alternative. We're all here gathered together. I had an office staff of 50 people. I sent them all home, almost 3 months ago, and we've been working seamlessly with teams. There's just no need to bring those people in any earlier than what's reasonably possible. And right now, I don't think we've met that reasonable standard of pulling people back together in large groups.
Great. Paul, I have another question for you from the audience, and this is from Angela. And she wants to know what advice or protocols you can recommend for cleaning outdoor common areas like patios, barbecues, grills, chairs, tables. The residents themselves in her building are not doing a great job, and they've posted some signage about wiping down services, but they want to protect themselves. So what would you recommend?
Just making the wipes and sprays readily available, having cleaning stations is about all you can really do. Unfortunately, this is no different than asking people to wash their hands after they go to the bathroom. What you think is a common practice and a normal standard and is widely accepted might not be for somebody else. And unfortunately, we all have different standards of cleanliness in our own personal homes and in our businesses. So really just having this stuff available, instructions, posting, it's just communicate. How many different ways can you communicate? These are what the standards are. If you just put the stuff out there and you don't communicate anything, you're probably not going to get any different result, would be my take on that.
Thank you so much. I'm sorry? Who said? So I'd like to turn to Vincent. We have a question here. What administrative tools do boards have to put teeth into the rules that they have around social distancing and other practices that they want to put into effect? Can residents be barred from using amenities? Well, we talked a little bit about that. Maybe, Fran, you might want to weigh in after Vincent. And what can a community do if residents consistently flout rules? Can they reduce services? What options do they have? So let's start with Vincent, and then we'll go to Fran to comment on that.
Thanks, Alan. Good afternoon, everyone. As far as administrative tools and the teeth into rules around social distancing and best practices, I'll combine that with using amenity space, because one of the big topics, especially at one of the larger communities we manage, 583 units, 2 pools. So we know for sure we are going to see, we have big crowds during, nice weekends. So of course we're going to communicate our rules when they are posted, and when we find out exactly what we can do, provide understanding on why we're providing these rules. And I think specifically for social distancing, some of the things we've been doing so far, I've been out with the pool company actually with blue tape and, marking around the pool already, like the New York City circles they had in the parks, to say, hey, how many people can we get? We're going to implement a bring your own BYOC, bring your own chair policy this season, because there's just no way our lifeguards are going to be able to keep up with the cleaning of the furniture if folks are getting up and then leaving the pool. One of the other ideas that we've toyed with was possibly not opening bathrooms, since folks can always go back to their condos. And we did decide we would allow guests this year on a limited basis. But I always like to try to provide solutions and not just rules to my communities. I think it fosters a better sense of community and give folks, an option and how to do something. So with that, that's pretty much the long and short of it. Yeah.
So, Fran, if you could jump in there, I'd like you to talk a little bit about can you bar residents, and they're paying for this, if they flout the rules? What is the recourse that the board has?
Sure, Alan. Like I mentioned before, absolutely you can. Alan, while I'm thinking of it, there's something that we do speaking engagements with the cooperator often, but I forgot to mention one thing. There's no attorney-client privilege here. There is no attorney-client, no attorney-client relationship. This is not legal advice, and anything you say to Alan is not confidential. So if you send him something and he discusses it with us and our 245 friends that are on this call, it's going to be disclosed. So nothing you say is confidential. Just be aware. Okay. So, but to Alan's point, yes, you can suspend the privileges. You can You can disable fobs in a high rise, et cetera, et cetera. One other thing to keep in mind about bathrooms and swimming pools, you got to be careful about, is not only you have to check the state, you also have to check the local codes, because most local codes require a pool to be open if you have the bathroom. I'm sorry, a bathroom to be open if you have the pool open and being used.
Mm-hmm.
You know, so just be careful about that in local rules, because you don't want your pool improperly heated because people don't want to walk upstairs.
Okay, along those lines, can a board or should a board reduce fees for residents if amenities can't or aren't open?
Can I jump in on that? I just want to remind all, we're zero-based budget communities, right? So we're not for profit. So we reduce fees, we've got to find those fees elsewhere. That's one of the difficult challenges we have with that question.
I understand. Fran, we do have one question. Someone would like to know whether a board can levy a special assessment to cover the additional costs associated with COVID cleaning, monitoring, or other protective measures.
So this is the classic lawyer answer. It depends. It depends. So most associations can levy a special assessment for additional cost, even though it's just operating costs that are outside the budget. But you have to look at your bylaws and master deed in particular, because some documents, many documents, require a membership vote for a special assessment over a certain amount of money, and some require a membership vote for any type of special assessment. So the answer is typically yes, but check your documents.
Thank you so much. Okay, let's move on to the next question. Harold, how are you over there? Good?
Well, thank you.
Could you give us some ideas as to how boards and managers and neighbors can help support and look out for vulnerable residents, the elderly, people living with disabilities or chronic health conditions, or others for whom the pandemic has made basic day-to-day functions even more difficult and risky?
Of course. And yes, first of all, good afternoon, everyone, and thank you all for joining in. Yes, I think that the answer to that, part of the answer to that question ties a lot of the things we've been talking about so far together. And that is, and the title of our event here, the right, Safety, Sanity, and Service. I'm going to speak a little bit to the sanity portion of this. Is that, and one of the things that I've been reminded of lately is our humanity, right? We're all human beings, and sometimes we get lost in talking about particular laws or bylaws or rules or regulations or what the governor's executive order says. And we sometimes lose track of the fact that we're all human, property managers, attorneys, service providers, and our residents. And I think that one of the things that we have all recognized is that, yes, a lot of our communities do have vulnerable people, some of whom aren't even aware that they are vulnerable, but certainly that has been proven to be the case. I think to tie this all together is communicate, and Paul said it well. Communication is so critical, okay? One of the things we've done in some of our communities, in particular for communities we know have vulnerable populations, and we've been able to identify some of those folks, is we formed some ad hoc committees, whether it's a small group of owners or even a couple of board members, and we have worked in conjunction with them for reaching out. Basically, it's an owner and resident reach out committee that says we're going to divide up the names and we're going to reach out to people in ways that they are used to being communicated with. Some folks just aren't on emails. We're going to have to reach out via phone call. Some people are, prefer to just receive something in the mail. But we use the different platforms of communication, email, regular mail, phone calls, notices that we post, et cetera, to check in with people, to make sure that, hey, we're just checking in. We want to make sure you're okay. We want to understand if there are any particular concerns that you have or questions that you have. And please don't hide in fear or decide that you can't find this answer anywhere. That's the resources, the property management companies where it starts. And through these committees, like I said, we've been able to reach out to people and offer them additional protection if need be.
That's great. So what I'd like to do is I'd like to sort of take a little follow-up on that, which is, have you had experience in specific properties where this has already come up, and can you give us some real-life examples of how people are handling these situations?
Yes, actually it has been. And as people are aware, that we oftentimes are the first ones to get, as property managers, we're the front line. We get reports of everything, right? Whatever it is The owner sometimes, even before dialing 911 during an emergency, will call their property manager. So we do hear about certain things. And obviously, our goal is to serve the entire community at the direction of the board. But we will oftentimes hear that someone tested positive for COVID-19 or someone is having other types of health issues. Obviously, we are obligated to protect privacy in those situations, but we do also have an obligation to the entire community to let people know if there's an additional threat, whatever that threat might be. And so in one particular community, we were notified that, yes, this was exactly what had happened. There, unfortunately, this particular unit also had a plumbing emergency. And so we had a particular difficult case to deal with. We knew this person in this unit had tested positive for COVID and was quarantining at home, and then had a plumbing emergency on top of which. We had to work with the owner of the unit. This was a tenant. We had to work with the owner of the unit to be able to provide the PPE, right, to send in an emergency person, and had to let that person know, hey, look, you have to go in with eyes open. You have to understand the situation you're going into and protect both or all participants as best we could, again, without revealing the exact unit or person to the rest of the community. But we were able to fix this problem, and no further damage was caused. Again, communication is key. It has to be, right? It has to be accurate communication. It has to be consistent communication, again, over all the platforms, calls, emails, written, et cetera, and it has to be timely. So
thank you so much for sharing that with us. That's a great, very interesting story. All right, what we'd like to do now is we'd like to give you guys some questions that we have from the audience. So first we have a question from Mary in New York City, and we've had a few questions along this line which has to do with apartment renovations. So basically, how soon can apartment renovations resume? And what precautions should be taken with contractors who are roaming hallways and coming in and out of buildings in general? We also have a question related to this, which is when in the reopening phases will buildings allow contractors to come in and do work? She's aware that some buildings have put limits on the number of move-ins and move-outs per week, as well as the number of large deliveries permitted during the week. So can you comment on this, Vincent? Would you like to comment on this?
Yeah, well, I know in New Jersey now that we're well into phase one. We're over phase one, and once the construction ban was lifted, we started up with a lot of our buildings with projects that we needed to move on and continue to get our contractors moving on. I have been a little repairs that association needs to make within units. I can say that I am dragging those out a little bit right now. If I don't have to go into a unit, I would rather err on the side of caution. But at this point, denying any residents from construction work, we're not doing at this point. They're allowed to go.
Great. Harold, would you like to add a little something to that?
Yeah, we'll add a little something, and that is one of the things, again, part of the communication. It's protocols we've worked out with our boards. That, yes, as Vincent was saying, they lifted the ban on non-essential construction, so that we want to encourage people to obviously maintain their place, especially if they have something that's urgent, if not emergent. But definitely communicating the protocols. In this particular property I'm thinking about, there was actually 2 or 3 units that had held up their renovations and were anxious to get started now that the ban had been lifted in New Jersey. We said, okay, it's contingent on this, right? And these are the protocols you have to do. They had to lay down plastic on the areas that they were bringing in men and materials. They had to make sure they had to communicate this to their vendors and their delivery people, is that if anybody was sick, they were not allowed on site. Everybody had to have PPE, gloves, masks, etc., and they had to practice social distancing. Well, you can imagine that sometimes that leads to problems. Construction is a definite problem in social distancing. The typical response was, well, geez, we got this heavy piece of thing we got to lift, and 2 guys have to lift it, and how are they going to be 6 feet apart? Again, we have to work around that to the best of our ability. But
that's thank you. Fran, is there anything from the legal perspective that you would want to add to that question?
So, as Vincent and Harold said, many associations are going forward with these types of things, but not all, not all. So there is no one size fits all answer. There's no one size fits all answer. So as I said before, you need to look at what are your facilities and who lives there now, right? So for example, if you're a high rise, but you got no freight elevator, and all this construction has to go through your regular elevator, that's a very different thing than your place with a totally separate elevator. You can handle everything differently. The same thing with the people. If you have very highly at-risk people on a certain hallway, right? The gentleman across the hall is in the middle of cancer treatments. You may want to delay the kitchen renovation across the hall because that gentleman who may be taking cancer treatments right now may be especially at risk for coronavirus. So again, it has to be looked at case by case based on the facts, no one size fits all.
Paul, do you have anything practical in terms of actually doing the move in, move out, or the construction and handling this kind of stuff that you'd like to share with the audience?
And that's a lot of what we're seeing on the disinfectant side is especially in the homeowner front, is people wanting that service completed during that transitional time. It's probably just logical. It makes sense. Somebody else has lived in the house. They're out for a moment in time. We can get in there, do a treatment, and they know they're walking into a virus and germ and disease-free home. One thing I just want to throw out there that I hadn't heard mentioned, it may be commonplace in most places, but just the use of logbooks and tracking who's coming on site. And I realize case by case that may be situationally difficult, but trying to keep a traffic flow of who's coming through your facility is certainly can be helpful. I can tell you my commercial technicians, as they're out and about just doing their regular services, now they're going through new protocols in all these places that were never seen before, taking temperatures, logging into logbooks, just questionnaires. And it's going to be part of the new norm, and for people, for contractors and vendors like ourselves to see those, and we'll expect it and we'll adhere to it. PPE, it goes without saying, that was already mentioned. But those are just some of the things that I think really just being able to track that for your clients, and they want to see that you put some pieces in place so that you know who's coming and going from that site.
Thank you. So we have a question from for Harold and Fran from Dawn. Are there any liability concerns for boards and other residents who wish to do more proactive outreach to residents who are struggling or who need assistance? Their board created a volunteer help group, but they want to know that they make sure that they don't inadvertently expose themselves to claims or risk, or to expose the association to claims or risk. So, Fran, you want to start, and then we'll go to Harold on that?
Yes, and I think Harold was the first person I ever heard call a lawyer a human, which I'll take as a compliment. But that being said, I have to rain on the parade, right, as usual. That's the lawyer's job. So the answer to Dawn's question is, if you assume a duty, you must perform that duty with a reasonable level of care. Otherwise, you will be sued and found liable. So once you assume a duty, you must act reasonably in fulfilling that duty. Just 2 seconds, one of the classic cases on that comes out of a large hotel chain was sued because the husband called the hotel front desk and said, hey, I haven't heard from my wife in a little while. Could you go check on her? And the concierge went looked in the room and said she wasn't there. The husband called back hours later and said, hey, I still haven't heard from my wife. What's going on? And hours later, they found out that the wife had a stroke, fallen between the beds, and the concierge had not actually looked in the room. He just flipped the light on and just looked in a cursory manner. Well, you can imagine that the hotel chain got stung for a very big number. Fortunately, the woman recovered, but she was very much physically impaired because of the hours that had lapsed since she had her stroke. So you got to be very careful in assuming a duty.
Harold.
Fair enough. And the part that I mentioned that was Fran being human, that probably was the lawyer side of it. But so, okay, let me give the humanity of this situation. Look, the tendency to help amongst our populations, the residents in a community is admirable and should be encouraged. I agree with Fran. Look, you have to be aware of the potential risk, right? And I tell people, and Fran has heard me say this, anybody can sue anyone for any reason at any time, right? You just need the filing fee. But leaving that aside for a second, and Fran is always looking for business, I know. So, but leaving that aside for a second is that we want to encourage the best in our residents, right? Oftentimes, and we've talked a lot here about the stick, right? Like, what happens if somebody doesn't listen, or what happens if somebody doesn't want to wear a mask, or, you know, and we talk about the stick and what they can do to impose their will on residents. The carrot is also, I think, a big piece of this. To be able to convince people on the buy-in that says, look, this is for everybody's benefit. We're all working and trying to help each other. And yes, we want to have committees. We would caution, and we have in my associations and Vincent's associations, we've cautioned people, look, if part of what you mean by helping is you literally want to go running into their apartment without a mask on or without PPE, let's stop and think about this. But certainly calling or emailing or reaching out in those ways, much safer ways to start, would be where we would steer our committee.
Great. Thank you. We have a question that I'd like to direct initially towards Vincent. It's from a board member in an association in New Jersey. She says, we currently have a situation where we don't have any employees. And when they reopen the association amenities, which is a pool and a tennis court, how would they find a company to provide a social distancing ambassador or a monitor? And also, would their association insurance coverage be enough to cover that monitor, or would they need supplemental coverage from workman's comp?
Yeah, so that's a good question. We do have a similar situation at my community, one of my communities, where we've got 2 pools, 2 tennis courts. So we're asking ourselves, well, we know for a fact that our lifeguards alone during a regular season have issues in maintaining the rules at the pool. And we take those each year with a grain of salt. When we get the emails on the weekend or on Monday mornings when we're hearing it from residents, we're nodding our heads a lot because we know they're 16-year-old kids, and how much can we expect them to stand up to an adult? And some of our adult residents aren't the friendliest of people sometimes. So yeah, we're looking into solutions as well for those social distancing. I guess not security guards, but just more of an adult person that can be there for us, that can monitor this. And one of the challenges with that is the financial aspect of it, because I had just received a quote today and it came in at about $22 an hour. So then we say to ourselves, do we now limit our pool hours, or do we limit our social distancing patrols to only Fridays through Sundays when we know we're going to see larger crowds, and Monday through Thursday we'll just put that on the lifeguard that we hope not to see these large crowds coming to our pools. So the financial aspect is certainly a challenge, and by hiring a professional company, they are going to come with their workman's comp policy, so your insurance shouldn't be affected at all.
Great, thank you so much. I have a question that I'd like to direct to Paul, and this is really an interesting question. Their building has a garden, and the garden has tables and chairs, and residents have permission to eat and drink in the garden, but it's difficult to enforce, obviously, mask-wearing rules while eating and drinking. When confronted, a non-mask wearing resident claimed that they were adhering to the 6-foot social distancing rule, and clearly this is complicated. Consequently, residents are complaining that the mask wearing rule is not being enforced. It's challenging to try to keep everyone happy. And considering all the factors involved with this, what would you suggest that they do in order to try to come to some compromise here?
Well, that's an easy one, Alan. No, it's not an easy one.
No.
It's, this is something even I can struggle with when I go out to the, out and about in the town. You're never going to be able to enforce this 100% for people to wear masks. You can, maybe, enforce the social distancing aspect of it, Last I checked, I can defer to Fran, but I think that the ability not to wear a mask is probably still one of your innate freedoms, especially if you're outdoors. So it's just, there's no easy answer to that. It's just you've got that gets into the political aspect of it. Obviously, you've got one person that doesn't believe in masks. There's probably some stuff out there in Google. I'm not going to go one way or the other here, but you can find arguments for supporting either case, both wearing a mask and not wearing a mask. I can tell you through my training and PPE training that most people who are wearing a mask aren't doing themselves any favors anyhow, given the manner that they put them on, take them off, the number of times they touch other things, then touch their mask, the lack of changing out of masks, the reuse of masks that are supposed to be disposable, not washing masks that are washable. So ultimately, if I had to lean one direction, I think we have bigger battles to fight than whether somebody's wearing a mask or not. Social distancing is probably going to be first and foremost more important. Again, I'm not an industrial hygienist. I'm not a hygienist. I'm not a doctor. I'm just a guy with an opinion on that piece of it. From the disinfecting standpoint, there's absolutely nothing that you're going to really do, especially in an outside environment, in a high-use common area.
I understand. Okay. Harold, we've had several questions come in about non-essential construction and renovation projects. So let's say, people doing work in their units, more so than a plumbing disaster, which you talked about. What is the direction on purely aesthetic projects like painting and wallpapering? Should they proceed? Can they proceed? How should they be managed?
I think we addressed that a little bit, and Fran spoke to it also. I think that the answer is this. You do have to take it on a case-by-case basis. We have encouraged people to put off optional type things or aesthetic type things for the time being, just because the numbers aren't with you, right? The more people that you have in and out of the property, the more people you have milling about, the more opportunity there are for problems. So we've tried to encourage that. And again, as far as guiding our boards, some have wanted to remain with a ban on any type of non-emergent, work inside a unit. And we've been able to implement that. But we recognize the fact that buildings, complexes, et cetera, are in effect living, breathing things, right? They are in constant need of attention, repair, upgrade, upkeep. And it not only is that required on a regular basis, but it speaks to the quality of life and ultimately to the value of someone's investment. So we want to be able to protect that. And so, yes, if it's something that says, hey, I've been thinking about adding in an extension onto my thing for the last 3 years, it's like, well, let's hold off. But if it's something that they had this kitchen renovation or bathroom renovation, as long as they adhere to certain guidelines that we work with the boards on, and again, maybe that's in multifamily buildings, don't come through the lobby or the front door. We have side doors, we have rear doors. If we have a freight elevator, you use that. And as long as they adhere to certain things and we notify, again, we communicate with all the residents so that we do know if there's vulnerable residents in a certain area, we can either stop that or we can make them aware so they can take precautions.
Thank you. I'd like to address the next question to Fran. How should boards navigate? All right, let me phrase this a little differently. There's a lot of rules and recommendations out there coming from a lot of different directions. So should a board adopt a formal plan? Should they deliver that to residents? And what other precautions should they take? How does the business judgment rule insulate boards from litigation and costly judgments?
So, I'm a fan of a plan with respect to each amenity. Okay, so a plan for the weight room, a plan for the childcare room, a plan for the pool area, a plan for the sunroom, etc. So I'm in favor of plans, and I'm very much in favor of following the posters and using the posters on the CDC website for the guidelines, putting posters up everywhere, everyone on notice, as I think it was either Vince or Paul said. A big part of this is not only doing the right thing, but making the record that you have done the right thing. So I think it was Paul who said, log who goes there, who comes there, who goes back there, etc. but also make a record of what you've done, right? So if you have people cleaning things, you want a log of the cleaning things. If you have rules and regulations, they don't necessarily have to be written by an attorney, but as long as they're consistent with CDC, et cetera, you keep a log of them. You know, these were the rules and regulations for the weight room at the time, because making the record is very important, because perhaps one day you wind up in a deposition, you want to say, oh, by the way, we were excellent managers and we did the following things. Number one, we hired Viking and they did such and such. And then we hired this company and did such and such. And then we put up CDC posters. And well, how do you know that? That's an amazing memory, Harold. Well, it's funny you mention that, because I have this binder here, or this file on a zip drive, and it shows everything we did over that 4-month period. So thank you for asking that question. Right? So
You're very welcome.
yes.
Vincent, we have a question from Kelly in New York City. She says that lots of businesses and buildings are doing temperature checks on employees. Her management company is recommending this for all service providers and vendors. Should her building take on this policy, or could it be more problematic than beneficial?
That's a good question. I think that might be more of a Fran legal question there.
Okay, we can have him comment on that as well.
Yeah. So, well, I'll first comment. Logistically, I guess we would have to. It was like when the pools required everyone to have the automatic defibrillators. It's like, are we doing this right? And I think that was a big concern for us when we put those by the pool. That was one of my concerns. Like, yeah, we have it there, but what happens if on my watch or the lifeguard, does it wrong, and then someone is fatally or very hurt by this? And I've had boards that want to put those in lobbies and things of that nature. So I think that the big question, the big point I would make is, are we using the technology properly? Who's to say that my concierge is scanning the person properly that had a fever and the device was off or the battery was dead and he said, no, it's fine, he went in, and then who's ultimately liable because we ran that test?
Okay, Fran, do you have something you could add to that for us?
Sure, yeah. So Vince didn't tell me he went to law school, but his instincts are spot on. So what Vince is saying in legalese would be, beware of detrimental reliance. So detrimental reliance is when someone purports to be doing something and the population of the building relies on it and the building is not doing it properly. So, you have to be very cautious if you're going to do things like, hey, we're going to tell all the residents that we spot check the temperature of every person who walked through that revolving door, and they're good. So the deposition goes like this. Who checked the temperatures? The concierge. How was the concierge trained in checking the thing? Okay, to Vincent's point, when was the thermometer verified? Which kind of thermometer did you use? What kind of no-touch testing did you use? Okay, because what the way the plaintiff will couch it would be, if maybe I had some contributory negligence, maybe I should have worn my mask, I don't know, I didn't, maybe I didn't, maybe I did. Okay, but what I thought was I was good wandering around all the hallways. I was cool because the manager told me that every single person who walked through that door got their temperature checked. And now you're telling me that the battery was dead. Or now you're telling me that the concierge was a substitute concierge for the day and that person wasn't trained. So again, you got to be careful of detrimental reliance. And if you're going to assume a duty, make sure you do it right.
Great. I have a really terrific question here that I'd like all of you to comment on. We could start with Harold. And this is from Nancy in New Jersey. She says the township where her property is, the fire and safety department is putting off annual condo building inspections, but they're pushing residents to get dryer and vent cleanings done this month. They are a 55 and older community with many much older residents who just don't want people coming into their units for obvious reasons. How do they balance fire safety with health safety? So I'd like everyone to respond to this, starting with Harold.
Well, Nancy, that's a great question. That really is. And look, I understand and we have this situation for some of our communities. I don't know if this happens to be one of our communities, but we do have situations where, yes, for resident safety and also for resident peace of mind. Just talking about some of the things that are on the last question is that at the end of the day, it's really peace of mind that people are looking for. And there are ways to give that to folks without putting yourselves in a difficult spot. I think that, and again, depends on the town and what the direction has been. But if cleaning of dryer vents or sprinkler or other types of fire protection inspections, whether it be quarterly or annual, are required, yes. And we have vulnerable residents. We want to see, by working with the board, by working with the residents, by working with the town, can we put this off to a safer time, right? And if not, for some reason, some people, by the way, we have some residents in some of our communities who are like, no, I'm okay. I'll sign a thing that says I'm good. I want my dryer vent cleaned. I want my inspection done. We can set that up, and again, using the proper protocols with the communication. But the key starts with the communication. First, I want to know from the town: are they pushing and they'd like it to be done, or are they requiring it? Because that's a whole different ball wax.
Okay, Vincent, do you have something to add to that?
Yeah, no, I ran into already this similar scenario where we've had residents at one of my communities that knew the dryer vent cleaning was coming up, their 2-year dryer vent cleanings, and preemptively started calling the office, and their landlords were calling the office. So, we've delayed it from an association standpoint, just because we don't want to force people into a situation they weren't comfortable in.
Thank you. Paul, do you have anything to add to that?
Sure. I think the main thing would be just to, whoever your contractor is, if you decide you are going to move forward with the service, is contacting that contractor or that service provider, asking them for what their written COVID protocol is, how they render services, what to expect when their technicians show up. Do the technicians come with proper PPE? In essence, if they were going unit to unit to unit, they should really be changing out their gloves and boot covers or whatever every single unit. So making sure they're prepared to render that in what's a satisfactory manner and not be a carrier just transmitting it down the line. That could turn into a worst case scenario if they went into one unit that was actually an infected unit. So I think when I kick it over to Fran here, but there's certainly a liability piece that goes along with that of delaying dryer vent cleanings. It seems like if you put that off indefinitely and somebody has a dryer vent fire, that's out of my arena, but that's probably the first thing that pops into my head.
Fran, could you address that legal issue, if there is any, quickly? Because I have one more question we want to go to.
I'll get through it. So real quick. So the good thing is, as Harold said earlier, make the record. Base your decisions on facts. Find out, can the dryer vent cleaning be done from the exterior? Depending on the architecture, some buildings can have dryer vent done from the exterior. The other thing is, lawyers and other people are not always the experts that you need to ask the question to. So it may be good to get an opinion from a fire safety expert or an industrial hygienist that says, hey, you know what? The risk of going into units far outstrips the risk of a dryer vent fire at this time. But a lawyer's not qualified to do that. Most managers are not qualified to do that. But a fire person might be able to, or a healthcare person might be able to. So again, that's to Harold's point. If you're going to make a decision, make the record to support that decision.
Right. Harold, really important question about boards and managers and building staff. How much can boards and managers ask of building staff in terms of cleaning and policing common spaces and monitoring social distancing, enforcing mask wearing and other behaviors? You may have a fantastic super custodian, but confronting residents is difficult. How can we support the staff and be sensitive to these interactions and stay safe all at the same time?
Yes, I think Paul said, that's an easy question. Yeah, no, unfortunately, like most of these questions, it's difficult and it's nuanced. So first, staff, right? Let's talk about particular staff on, employees of the association. Yes, I think, again, back to the communication aspect of this. It's important to communicate with the boards and determine with our property manager with the board what the protocols would be and what we're going to ask the staff to do. And then it's important, like with any other employee, like I've done with employees at Denali, or like we would do with an employee of an association, is to sit down with each one, or these days perhaps by phone call, and explain to them, this is what we're going to be implementing, and here's why. Because again, this is not about like, hey, just do this and don't ask questions. This is about getting a buy-in from all parties, all interested parties, both the employees, the residents, the board, the property manager, their hired professionals. You want a buy-in here. And the buy-in is there's something of value for everyone. And for the employees, the something of value is, look, we're not making this up. We're following certain protocols here, and it's for the benefit of all, including keeping us safe, which nobody would argue with. Second, same thing is with residents. Say, look, I know we've had sometimes residents, as most associations do, who don't want to be told what to do, especially by that concierge or that porter. And again, we ask, this is where this is coming from. It's not coming from them. It's coming from us. We post the notices elsewhere so they can see it, and we make them aware of it, and we ask for the buy-in. We use the carrot more often than we would like to use the stick.
Thank you so much. I'd like to ask each one of you to make a short final statement. To wrap up what we've talked about today, we'll start with Paul and we'll end with Harold. So, Paul, you're on.
Sure. Again, thank everybody for their time and for joining us. Certainly this is just the most unusual of times for most of us that we've ever been through. And it presents challenges, both for us as a service provider, being able to deliver high level, which we're usually a very customer interfacing type service, and the challenges that it presents in order to keep all of our clients safe. So if you have further questions, I'm available. I think our contact information is there as well. Happy just to be an acquaintance or a consultant if you have questions, especially on the disinfectant side, or if it happens to be on the pest side. Obviously, that's our primary business. So thank you for your time.
Vincent.
Right. Thanks everybody for joining. Now that we're into phase one officially, going into phase two, I think all property managers out there can take a bit of a deep breath, because folks are going back to work. We love our residents, but I know for all of us, it's been very taxing with having everybody home 24/7 for the last 3 months. It's been taxing on us. It's been taxing on our communities. So just all my property managers, stay strong, keep up the good work. Thank you.
And Fran, please.
So quickly, thank you again to Denali and the cooperator for hosting this. This is great. 4 points, real quick. Communicate proactively. Don't wait to be attacked. Communicate first. If you're not going to open the gym, tell people that and tell them why. Number 2, make the record. As Harold said, and everyone said, Vincent said too, make the record, make the record, make the record. Request a premium abatement. This is not being talked about. Request a premium abatement on your insurance if you're not opening up all these amenities. I'm not saying you're going to get it, but why should an insurance company be paid for insuring a pool and a weight room and everything else? It's not even being open. And challenge denials of insurance company coverage. So if you report a claim to the carrier, turn it over to your attorney, say, hey, look at the policy. Hey, maybe we're really entitled to coverage under the policy. Everyone's saying you're not entitled to coverage, but think about it. Refer to your attorney. And thank you so much.
Harold, you have the last word.
Hopefully not the last word. But yes, I want to thank you. I want to thank the cooperator. I want to thank Fran and Paul and Vincent, everybody for participating. I hope folks who found it informative and got something out of it. Just to kind of sum up, I think what all of us have been saying. I think the key truly is communication. And to bring a little bit of sanity to this whole process, right? It has been a stressful few months for all involved, even the human side of the attorneys. So that what we want to do is be able to say, look, all of the things we discussed in terms of communication, in terms of protocols, in terms of working with residents, working with boards, working with employees, working with vendors, are stuff that should be done by a good property management company no matter what. However, these days, it's particularly important to be timely and accurate on this stuff. But the other thing I want to just leave as a caveat is, let's not be experts, right? We've heard the expression, stay in our lane, right? We're not attorneys. We look to the attorneys for legal advice. And as far as advice on medical or PPE or any of that type of stuff. The CDC provides guidelines. And we tell people, look, it's not necessary whether you believe it or not, or whether you believe masks prevent spread of disease, is not as important as this is what we've determined working with the board is the best way forward. And we've asked for everybody's buy-in. Even if you don't believe it, this is going to improve the quality of life and ultimately preserve everybody's values.
Thank you so much, gentlemen. This has been very informative.
Thank you, Alan.
Thanks, Alan. Have a great one.